For this session, I would like to invite our chairperson, Dr. MLB Bhatt sir, ex-Vice Chancellor, King's George Medical University, Lucknow, co-chairperson, Dr. Mini KV ma'am, Professor Guru Shri Gorakshnath, Institute of Medical Sciences, moderator, Mrs. D. Jaini ma'am, Professor Guru Shri Gorakshnath College of Nursing, rapporteur, Ms. Kavita Sahani ma'am, clinical instructor, Guru Shri Gorakshnath College of Nursing, technical expert, Mr. Prabhu sir and Mr. Akshay Edward sir. Now, I would like to invite the moderator, Mrs. D. Jani ma'am, for the further proceedings. Please, ma'am.
Welcome every morning with a beautiful smile. Morning is God's way of saying one more time, go live life, make a difference, touch one's heart, encourage one's mind, and inquire one's soul. I'm Professor Jenny, Guru Shri Gorakhnath College of Nursing, Gorakhpur. A very warm good morning to one and all. Good morning to our honorable dignitaries, distinguished guests, respected principal ma'am, learned delegates, beloved faculties, and my dear students. With great joy and immense exultation, I feel privileged to extend my warm welcome to all of you for the first session of this day of International Conference. It has become a regular aspect and part of our nursing profession to update ourselves with the growing demands in the health sector. To fulfill that aspect, our esteemed institution has organized this wonderful event today. To accomplish great things, we must not only act but also dream, not only plan but also believe. I take this opportunity to thank our great management, respected Vice Chancellor Sir, Registrar Sir, and our loving Principal Ma'am for creating this day and brought all great experts under one roof. A warm welcome to our cherished leaders of this great university. I also consider it a great honor to have the chairperson of the day, Dr. MLB Bhatt Sir, ex-Vice Chancellor, King George Medical University, Lucknow. If your action inspire others to dream more, learn more, and become more, you are a leader. At this juncture, I would like to attribute this proverb to our chief guest because his valuable past makes him important today and it will make an impact on the future generation. We are proud to have you today, sir. On behalf of our college, I welcome you, sir. Next, my great privilege to have one of our co-chairperson, Dr. Abhay Narayan Tiwari, Senior Ayurvedic Physician, Rajasthan. We are really happy to have you on today's session, sir. Next, it's really a honor to have our co-chairperson, Dr. Mini KV Professor, Guru Shri Gorakhnath Institute of Medical Science, Ayurveda. We are really happy to have you today, ma'am. On behalf of our college, I welcome you. Now, it's my privilege to extend my warm welcome to all the delegates and paper presenters, research scholars from various institutions. I extend my hearty thanks to their management, providing them the chance to be a part of this great event. With greatest pleasure, I'm happy to introduce the team, my rapporteur, Ms. Kavita Shani, technical experts, Mr. Prabhu and Mr. Akshay Edward, faculty of Guru Sri Gorakhnath College of Nursing, to support for great successful completion of today's session. Thank you all. Let me put forward a big thank you to all who are present here on this occasion with us. We were overwhelmed by splendid response. The theme chosen for today's first session is Ancient Indian Knowledge System and its contribution towards nursing. Real knowledge is to know the extent of one's ignorance, said by Confucius. Knowledge is the eye of desire and can be the pilot of soul. A people without knowledge of their past history, origin, and culture is like a tree without root, started by Marcus Garvey. We owe a lot of things to the ancient Indians, teaching us how to count, without which most modern scientific discoveries would have been impossible, which was authored by Albert Einstein. Yes, our Indian civilization has accorded immense importance to knowledge. Its amazingly vast body of intellectual texts, the world's largest collection of manuscripts, its attested tradition of texts thinkers, and school in so many domains of knowledge. In Bhagavad Gita 4:33, 37 to 38, Lord Krishna tells to Arjuna that knowledge is the great purifier and liberator of the self. The traditional Indian knowledge system of validating and putting into practice has impacted our education, arts, administration, law, justice, health, manufacturing, and commerce. This knowledge made successes and challenges and provided a sense of Indians' future aspiration specific to education, health, environment, and indeed in all aspects of life events. The main objective of drawing from our past and integrating the Indian knowledge system is to ensure that our ancient system of knowledge, represented by unbroken tradition of knowledge, transmission, and providing a unique perspective that is Bharatiya Shri, is used to solve current and emerging challenges of India and the world. Between stimulus and response, there is a space. In that space is our power to choose our response. In our response lie our growth and our freedom. As we are moving into the first session of today's international conference, I would like to begin the session with paper presentation by the research scholars. Now, for the first paper presentation, I invite Mr. Shubham, Infection Control Nursing Officer, AIMS Gorakhpur, to present his work.
A warm good morning to everyone present here. My name is Shubham. I'm working as Infection Control Nursing Officer at All India Institute of Medical Science, AIMS Gorakhpur. Today I'm going to present a paper titled as Enigma to Artificial Intelligence. This is a review article already published in Pondicherry Journal of Nursing last year. According to Alan Turing, computer scientist, logician, and cryptanalyst, a computer would deserve to be called intelligent if it could deceive a human into believing that it was a human. The potential power of usage of artificial intelligence, a computer program that is capable of making intelligent decisions in the healthcare, is enormous and undeniable. The emergence of AI in the healthcare system result in its consequences for healthcare delivery. Also, its involvement in the health service management, drug prediction, patient illness diagnosis, and usefulness in the clinical decision making. As well as this article emphasis on its value in optimizing medication adherence and its efficacy. Machine can take over human in near future. Artificial intelligence has become a major threat in healthcare, with its impact expanding across the health sector. Healthcare provider must take steps to address this issue. Artificial intelligence enabled decision support system can help improve patient safety by detecting error, patient stratification, and drug management. Story so far. The term artificial intelligence was first used by American computer scientist and cognitive scientist John McCarthy in 1979. Throughout World War II, Alan Turing, computer scientist, logician, and cryptanalyst, published technological devices and developed the Turing test for assessing intelligence. He cracked unbreakable Enigma code by constructing a machine to decipher them. Turing believed that by 2000, people would accept the idea of artificial intelligence. Healthcare provider to population ratio. Even in the digital era of things, machine intelligence, and technology, humans still fall short of achieving holistic health for all. With the average of 150 doctors per 1 lakh people around the world, India has only 64 doctors accessible for every 1 lakh people. As per the recent report submitted by Union Health Ministry to the Rajya Sabha, nurses to population ratio is 1.96 per 1000 people. Pandemic and artificial intelligence. As we are well versed in the era of recent pandemic, online doctor consultation and contact tracing using the Arogya Setu application, the COVID portal has helped us to tackle this adverse situation effectively. Artificial intelligence in the attainment of sustainable development goal. There is a there is a high scope of technology in the healthcare sector to achieve positive outcome in the attainment of good health and well-being. That is a sustainable development goal number 3. Potential of artificial intelligence in the healthcare. Patient safety and medical care delivery has increased with the introduction of AI into the healthcare system. AI automates tasks to free up internal workers so that they may focus on contributing more value in their domain of specialization. Machine-generated AI algorithms support clinical decisions made by the doctor in the area of radiology, cardiology, laboratory, procedure, post-surgery, and critical care unit. India's first de-identified cancer image library was created by Tata Medical Center and all in Indian Institute of Technology for evaluating vast amount of healthcare data. Technologies for detection of speech and image are being used to provide more effective treatment for patients. To detect diabetes early, Niti Aayog has been looking forward to introduce AI to manage this issue. Artificial intelligence and robotic nursing amalgamation. To counter the threats of increasing old age population and to maintain the ecosystem of human productivity, the country like Japan has introduced robotics in healthcare delivery. Robotic nurse assists the patient in moving around or executing simple activities such as collecting vital signs as well as providing prescription, for example, Android demo. Here we can see the robot Riba and Actroid app. Robot Riba can lift a patient up to 61 kg and help transfer the patients. Actroid is a tele-robot designed after a human female that can be operated remotely and can replicate the expression and word of an operator. There are other robots like Stan the Man, which is used to train the nurses and healthcare professionals. Furthermore, medical robots do not yet possess the skill of performing compassionate nursing care that is expected of a human nurse. Artificial intelligence in the healthcare, a critical perspective. Using clinical and laboratory data from over 4 lakh patients, Apollo Hospital and Microsoft AI Network for the healthcare are creating a machine learning model to identify the risk of heart attacks. Without the need of a thorough physical examination, the AI solution may uncover new risk factors. A machine learning technique called reinforcement learning involves an algorithm that tries to complete a task while learning from its success and error. Studies have demonstrated the outstanding accuracy of AI in the realm of medicine. Healthcare workers typically lack the technical knowledge necessary to operate advanced artificial intelligence. They lack the training necessary to recognize AI flaws that could lead to the deceptive result, such as discrepancy in data or error in software. This might lead to the substandard treatment and ineffective medicine dosing. However, the entirety of the effect of data would not be seen until it is used by the healthcare practitioner or integrated into the healthcare institutions. Artificial intelligence is used to foresee drug interaction, concentration, pharmaceutical safety. The capability of doctor to reliably identify error at any stage of AI integration could be impaired by high level of automation based on AI, which could also result in over-reliance on AI-based alternatives. Advantages of artificial intelligence. All facets of medical treatment, including image-based diagnosis, are being investigated using artificial intelligence. It possesses the ability to help physicians in establishing more accurate diagnosis and has assisted in the pharmaceutical research, tailored medicine, and care delivery supervision. Electronic health record (EHR) system now use AI in order to assess, examine, and get rid of health risks for the patients. Artificial intelligence-enabled robot pet delivered care to the dementia patients. Robots powered by AI are useful for the early diagnosis, drug development process, drug trial, cardiac disease, and ocular and cancer treatment. Due to their unpredictability or fluctuating nature, there has not been much research on their ability to replace human nurses. Challenges of artificial intelligence. Elon Musk has said AI is more dangerous than nukes. Atomic weapons are no longer a concern. Cyberterrorism is a more serious menace. Recently, AIMS Delhi suffered a ransomware attack compromising the data of 3 to 4 crore patients. Delhi Police, Ministry of Home Affairs, and Indian Computer Emergency Response Team that is CERT-in tries to resolve the problem. AI advancement may lead to the extinction of human species. This is the future perspective of the advancement of AI. Patient confidentiality is a big worry for the healthcare practitioner since non-acceptance and adoption of healthcare worker and patients are difficult. With AI usage in the medical sector, the range of risks and obstacles may arise at personal, macro, and technological level. It has an impact on functionality, execution, confidentiality, and safety. An error in the system utilized by the AI can lead to the considerable number of patient injury. Additionally, since different institutions manage the medical information in different way, inaccuracy could take place whenever data from one organization are interpreted by the AI model that are trained at another. Weighing up both sides of the argument by identifying mistakes, categorizing patients, and managing medication, AI-powered guidance system can assist to increase the confidentiality of the patients. A significant number of studies found that AI has improved security consequences, identifying the amount of detail, accessible, and veracity of forecast and information is the AI toughest difficulty. To ensure a precise projection and to understand how AI will affect healthcare security, it is crucial to comprehend the evidences. Instead of replacing healthcare professionals, AI technology aims to assist them in raising the general efficacy and accessibility for the healthcare. Artificial intelligence integration in healthcare is not a pipe dream. Particularly in medical institutions, the government should establish AI courses and curricula. Amritkal. Amritkal is a Vedic term. It means critical time when the gates of greater pleasure open for inhuman, angel, and human being. Amritkal is considered the best and most auspicious time to address and start new work. This Amritkal word is used by our Honorable Prime Minister um, at various platforms nationally and internationally. While we live in Amrit Kal, India is ideally positioned to demonstrate leadership in advancing Vishwaguru ideology by adopting artificial intelligence, Internet of Things across the health sector. Thank you.
Thank you for the wonderful presentation on the most wanted topic in today's world. And now it's time for the discussion by the chairperson.
Very well presented. Congratulations. Any questions, comments, clarifications from the floor? Any opinion?
It's a time for open discussion also. Students and delegates, if you have any queries on this, you can ask.
Yeah. Are you? No. So you should always come prepared with the questions. Whatever the topics are going to be discussed, you all should read that topic so that have the basic understanding what you are going to listen, and that will make comprehension better. So if there is no question, I think we move on to the next.
Sure.
Thank you very much.
Thank you so much. Yes, sir. Yes, sir. Yes, sir.
What you have to say?
Yes, sir. There is a concern of artificial intelligence that it may lead to the extinction of human species even. So what we can do is, sir, we can use the artificial intelligence as a complementary, not as a total replacement, so that it can improve the effectiveness of delivery of healthcare, and it can helpful for the advancement of various surgical procedure and everything. It can never ever replace the human being. It can never replace the doctors. It can never replace the nurses. What it can do is artificial intelligence only can complement and add on to their healthcare delivery and to their for the efficiency of their work.
Thank you.
Thank you, sir.
Thank you, sir.
One more question.
Yes,
There is a robotic surgeries and all are present nowadays.
yes, sir.
So what about this AI and together with this robotic surgery?
Yes, sir. I
It is
think
not taken.
yes. Oh, thank you. Okay, thank you. I think this is going to be one of the revolution in the field of medicine, because as per the various report, we have find that on the we have India has lagging doctors. As I had discussed in one of the slides, we have only 64 doctors per 1 lakh population. So I think with the introduction of robot in the surgery and medicine, it can help for the coverage of population. It can help to deliver a care to a large population in a small span of time. So this is how robotic surgery will be revolutionary if it comes to the Indian health system. Thank you.
I need to state of your question. Actually, the robotic surgery was done first in India, in Tamil Nadu, Chennai, Apollo Hospital. So it has been on practice. So I think it has reduced the human effort so that many patients can benefited with this AI and robotic. Sure.
Thank you, ma'am.
Thank you very much for the wonderful presentation. And again, I request all the students to listen the presentation and prepare your questions. So after each session, we will ask a discussion so that you can share your opinions also. Next, for the second presentation, I call upon Ms. Sashi Sharma, Infection Control Nursing Officer, AIMS Gorakhpur, to present a paper.
Hello, good afternoon everyone. This is Sakshi Sharma, working as infection control nursing officer at All India Institute of Medical Sciences, Gorakhpur. So today I am here in front of you presenting my paper on future of nursing, that is artificial intelligence empowered nurses. I am extremely thankful to the organizers for giving me this wonderful opportunity for presenting my paper at this international conference. So the abstract of my study is, with the upcoming drastic change in the epidemiology and demographic profile of the population, nursing officers and updated terminology for nurses can help people recognize their needs, and they can inform public regarding the future planning for the cost effectiveness as the life expectancy is increasing. Continuing nursing education is an important aspect that keeps the nursing officers updated with the latest practices and issues which are necessary for patient care. The nursing officers should work on reducing the cost of healthcare by inducing creativity and overcoming various challenges. Nursing officers can work to create the transition from illness to wellness by promoting the lifestyle changes. There should be a focus on using the research findings and evidence-based research in patient care. In the era of globalization, the sharing of products and finances will continue to grow. Nurse practitioners and various specialties can provide care to patients. The amalgamation of the artificial intelligence and robotics can amplify the horizons of care which are provided by the nursing officers. The future of nursing belongs to involving nursing students, patients, healthcare workers, and the community in the adaptation to the evolving advanced technology in terms of nursing education, services, administration, and research. So the introduction of this topic, what is the meaning of futuristic? It means revolution or innovation, that is introducing a new idea, method, or it may be product. The amalgamation of technology in providing care to patients, families, and the communities from birth to the end of life is an art of modern nursing. It is the time for nursing to question and redefine its role within the system and to take steps to bring about the future that the nursing profession is to achieve. Nursing profession needs to begin to recognize new trends and patterns that are emerging in healthcare. The future of healthcare industry. So in future we will be having the beds which will be designed so that they can rotate the patient periodically. The drug administration will be done using the computer-driven equipment. There will be an increase in the need for knowledge, physiologic and the psychological functioning of the nurses. And there is a need to update with the recent research. And the more focus will be on on the wellness and prevention. And nurses will play an active role in preparing the citizens for healthy lifestyle. The reasons for changes in nursing education. As we see that there are changing demographics, the rise of technology is there in modern era. We are more focused towards the urbanization, and this is the era of globalization, increased expenditure on healthcare, and the evidence-based practice which is most commonly used in nursing nowadays. So what are the aspects of futuristic nursing? So in future we have the four main domains in which the nursing profession has to flourish. The first one is nursing education in terms of nursing services, nursing administration, and the nursing management. So the areas of emphasis, the course design of the curriculum has to be in such a way which is a cost effective curriculum can be there. Then as we see that there is a wide diversity of the students which are present in nursing schools and colleges. So which promotes the multicultural learning of the students, and the curriculum has to be designed in such a way which focus on the critical thinking of the students, and by this, we can promote the community's health and the future focus for education. So, teaching innovations, and we should have an adaptive curriculum, practical and need based learning, technological involvement, and the research incorporation so that we can validate the teaching approaches in the nursing curriculum. So we have talked about the nursing. Here we are in this slide. We'll be talking about the scarcity of nursing officers. So we have a recommendation which says that every 1,000 population we should have at least 3 nurses. But in India we have the ratio of 2.3 is to 1,000 population. So we can see that there is a scarcity of nursing officers, which leads to a various rise in the nosocomial infections or the hospital associated infections, and it also increases the medical errors. The occupational injuries are increased, which also leads to the unsafe working conditions, and it ultimately increases the stress at the workplace. So what could be the probable solutions? The probable solutions are regular recruitment. Nowadays we have NORCET examination which is held every year, and they have a recent update that they will be conducting it every 6 monthly. Then technological empowerment, such as the previous speaker told about the artificial intelligence. Then the clarification of existing roles and responsibilities, and the high quality continuing nursing education CNE, which can be organized. The solution for the upgradation of nursing profession in future. So mostly the future will be focused on telenursing, nanotechnology, and the robotic nursing. In service education and continuing nursing education. So in service education, we have the nursing practice. It will be focused on nursing research and mainly administration. The continuing nursing education, that is CNE, it will be helpful in updating with the latest practices, and it can tackle with the issues which are necessary for patient care delivery. And we have heard that some of the states have started mandatory credit hours, that is 150 credit hours over a period of 5 years for their license renewal. Delhi have started that. So some of the states have started, and this can be achieved by attaining and attending lot of seminars, workshops, trainings like this seminar conference we are attending. So online courses, so which are self-paced, and they mostly avoid the geographical barriers, so which are also very good. Then future of nursing administration. In terms of nursing administration, the nurse manager should take up the leadership responsibility to make the decisions which are required in policy making, and work on reducing the cost by inducing creativity and overcoming challenges. Good knowledge of the healthcare business, which can improve the efficiency of healthcare delivery, which is required in our hospitals. Participation of joint ventures so that we can promote the specific health activities or the services. Collaboration with other healthcare team members. The future direction for nursing research. The goal is to increase the understanding of health issues and their management. There should be the use of evidence-based practice, and the nurses, there is a need to sharpen your research skills and use of this research findings which can be inculcated in the patient care, and empowering the nurse researchers to generate the knowledge and the infrastructure which is the need of the hour. Nursing in the 21st century. In the era of globalization, the sharing of products and finances will continue to grow. Nursing officers will hold the responsibility of becoming autonomous practitioners. Nowadays, there are various courses of autonomous practitioners coming up in India. Then rise in nursing practitioners in various specialties such as critical care. Hospital stays will be shorter and the discharge counseling will be an essential area of concern for the patient. There will be more focus on using the alternative and complementary medicine and healing practices. To conclude my topic, nursing has come a long way with the ups and downs in society. Economic, cultural, and religion significantly impact the care delivery to the patients. The future of nursing belongs to involving nursing students, patients, healthcare workers, and the community in the adaptation to the evolving advanced technology in terms of nursing education, services, administration, and nursing research. The most important is the integration of all of these components, which might bring a change in the nursing practice in the upcoming future with the amalgamation of the artificial intelligence and robotics in nursing. These are my references. Thank you so much.
Thank you very much for the great presentation. There is nothing can replace human touch in terms of care, as nursing have everlasting scope. The topic you presented is really a needed one. Now it's the time for discussion.
Yeah. Questions are invited from the floor. Any comments? Fortunately, this is also a similar topic as earlier. Ms. Sakshi Sharma has done wonderful presentation. AI and robotics in nursing, education, training, clinical services, administration, research everywhere. Any questions? Most important is that you all get friendly with the AI and robotics. That is what is going to be the future of the healthcare. So we all have to be involved. If there is no question, we can move on to the next.
कोई प्रश्न नहीं है.
If you have any queries, raise your hand. The mic will be passed to you.
हमारे ख्याल से आपने जितनी भी प्रेजेंटेशन दिखाई, स्लाइड्स दिखाई, उसमें एक के अलावा हर एक में फरंगी नर्स दिखाई. तो हमारे बच्चे डर गए, लगता है कि ये आर्टिफिशियल इंटेलिजेंस, रोबोटिक, हाई फाई चीजें, इंडियन नॉलेज सिस्टम, इट इज फॉर द फरंगीज. आपको जानकर खुशी होगी, इसी जगह पे भारत के उत्तर प्रदेश के पूर्वी उत्तर प्रदेश के हिस्से पूर्वांचल में, जिसको साइटली लोग बैकवर्ड कहते हैं, यहाँ पे भी आर्टिफिशियल इंटेलिजेंस का अच्छा काम हो रहा है. लेकिन आप जब भी दिखाइए, हम लोग भी किसी से कम नहीं है. उससे एक संदेशा जाता है कि साहब ये जो हाईटेक चीजें हैं, दैट विल बी यूज्ड ओनली बाय द foreign countries, other European people. That mindset has to go. Our government is committed to remove this mindset. We are as such exporting nurses all over the world. We are exporting high-tech technology, software, everywhere. All the main CEO of the high-tech companies, they are Indians. So show their photograph. They are the better nurses. And we are the better nurses than this one. Once that mindset will go, everybody will ask questions and they will part of this game. Thank you.
Thank you, sir. If there is no question, then we close this presentation with one more observation that the nurse practitioner she has been talking about, the Indian government has launched the wellness centers all over the country, 150,000 wellness centers. And these, most of the wellness centers are going to be manned by the nurse practitioner. So with little 6 months of training, all of you can get elevated to the nurse practitioner. The huge opportunities are there in the status of and working environment for nursing profession, but we have to incorporate the AIs also. Because AI has already been incorporated, whether you want or don't want. Everything you are doing based on the AI is the only the artificial intelligence which is dealing so many activities. Dr. G.N. Singh addressing us from Lucknow. Someone from USA might be addressing us. So many things. So now it's understood that even if you prepare a PowerPoint presentation, you should have the reliance on the artificial intelligence. So thank you very much, Ms. Sakshi. Now we move on to the next.
Thank you. For the next presentation, I would like to invite Mr. Jnana Leonard, research scholar from Pondicherry Institute of Medical Science, for the presentation.
Good afternoon, one and all. My name is Leonard, and I am a PhD scholar from Pondicherry Institute of Medical Sciences, Puducherry, and I am doing that as a part-time external. And currently, I work as associate professor in Adventist College of Nursing, Bangalore. My family is there in Bangalore. Well, if I ask you the question, my title is Effectiveness of Cerebro Training Exercise Module on Brain Functions Among Aging Adults Staying in Elderly Care Homes, Bangalore. If I ask you the question, can you name some games that originated in India? You may think about cricket, maybe you think about exercises like yoga, or maybe many other things that are very famous, because Indians are known for cricket and many of the top players in cricket are from India. And I also have some games like snooker, chess, and badminton, and many others all originated in India and were transmitted to other countries through migration or colonization and turned into the forms we would recognize today. Dhanurveda was one subject of education which taught the science of warfare and included use of fighting weapons as well as horse riding, wrestling, and chariot driving. Chatusashti Kala was a study of hobbies, including physical training, and had 64 arts. These could include martial arts, swimming, archery, running, and weaponry. I'm talking all these things part of Indian system that was existing from ancient times. Let me ask you a general knowledge question. Where do you think is the world's oldest sports center located? Any idea? It's located in India, in Gujarat. And it was almost 3000 BC, they say. It was from that time it is existing. And if you see the origin of ancient Indian training clubs, in ancient India, sports training was broken down into several categories to ensure everyone developed a rounded approach to mind and body training. One of these categories was individual training and focused on physical development. We might recognize this as a physics-based training today. In fact, this concept of mind and body relationship has been a unique concept that evolved in India. Yoga is one of the prominent exercise that people use to bring about this relationship between body and mind. And as I was wondering about my research, what I should do, I learned it from my personal experience. Um, to be very precise in sharing my personal experience, I was an asthmatic when I was a child. Till my 12th grade, I had several episodes of asthma. And I learned from this same Indian system and elderly people that nature has its own ways to help us recover from diseases. So I learned from some literature that exercise and diet change would help me. So after trying several medicines and visiting several doctors, I became a vegetarian and I started exercising for about 15 to 30 minutes. Uh, 15 minutes of jogging and 15 minutes of stretching. And you would wonder, for the past 15 years, after my 12th standard, I have not got a single asthmatic episode. And that made me to put in some kind of systematic research in place to make it empirically possible for even others to follow that. So I chose this research, something based on this, that is about the brain function and how exercise impacts it. So cognitive functions or brain functions, as we call commonly, include the domains of perception, memory, learning, attention, decision making, and language abilities. Cognitive abilities are the mental skills you need to carry out any task, from very simple to most complex. And as we get older, There is no one in this world that they don't age. As we get older, what happens? Our brain functions started to deteriorate gradually. Some people, however, may experience severe form of deterioration in their brain functions, leading to some diseases like dementia, Alzheimer's, etc. But this can make it impossible to cope up with ordinary day-to-day tasks. If you look at your own grandparents or my own parents or our own elderly people, they find difficult to carry out their tasks because their mind has deteriorating to function. And I found out from literature that physical exercise, along with the fresh air in the nature, can be a promising way to reduce this cognitive decline and the occurrence of some related diseases such as dementia. So I thought this study would be a very relevant study. And if you look at the global elderly population, it is increasing every day. Studies says that states in southern India, where I come from, holds the most elderly population. Karnataka 9.2%, Andhra Pradesh 9.1%, Tamil Nadu 11.2%, and Kerala 12.3%. According to a study, this cognitive impairment was 31% among aging adults in South India. And according to a study, participation in community-based exercise program can improve cognitive and physical function and independence in activities of daily living among aging adults. So the problem statement for my study is a randomized controlled pilot trial to assess the effectiveness of cerebro training exercise module CTEM on brain functions among aging adults staying at old age home Bengaluru. The objectives of the study are to assess the existing level of cognitive function among aging adults staying in elderly care homes, Bengaluru. Number two is to assess the effectiveness of cerebro training exercise module on brain functions among aging adults staying in old age homes, Bengaluru. The methodology of this study is the approach was quantitative approach, study design was randomized controlled trial, the setting was elderly care homes or old age homes, Bangalore, urban district, Karnataka. The population include aging adults staying in elderly care homes. The target population was aging adults staying in elderly care homes who are aged 60 to 70 years of age. And the accessible population was aging adults staying in elderly care homes who are 60 to 70 years of age. Uh, the sample was the aging adults who fulfill the inclusion criteria, who stay in elderly care homes. Let me explain briefly how I did this. First, the ethical clearance was taken and permission from the authorities were taken, followed by um, a frame of all the list of old age homes which were taken in Bangalore. And I used a lottery method, simple random sampling method, to choose respective old age homes separately for control group and separately for experimental group. And after doing this, another frame was chosen to list down all the participants. About 198 old age people were screened in this, and out of this, around 40 people who fulfill the inclusion criteria were chosen for the study using simple random sampling technique, using lottery method. And after doing this, the group was divided into two, as I told you earlier, 20 in experimental group and 20 in control group. In the experimental group, this cerebro training exercise program module was taught, and they were asked to practice for 12 weeks or 3 months. And this exercise comprised of two components. One is a physical exercise. The physical exercise comprised of brisk walking plus some stretching exercises, and also the cognitive aspect, like in Indian society, people who are social, who talk with people, are very good even in their old age. That's my assumption. And that cognitive aspect included dividing the old age people into 4 to 5 people in one group, where they have to learn some event from newspaper or from somewhere, and they have to share with one another. This happens every week, and this improves their social capability and their memory skills. And they also were asked to memorize words, new words they find, and share with one another. And they have to practice this for 3 months or 12 weeks exactly. Whereas a control group were not taught at the beginning, whereas after 3 months of period, they were also taught this and asked to practice after my research is over, after my data collection is over. So this is how the data collection went on. The data analysis was done using SPSS software. A t-test was used to assess the effectiveness of cerebrotraining exercise module on brain functions among aging adults staying at old age home Bangalore, and a chi-square test were used to determine the association between brain function level of aging adults and the selected socio-demographic variables. The results were as follows. In the initial stage, the frequency in table 1 reveals the frequency and percentage distribution of participants according to the level of brain functions in experimental and control group. Out of this, if you see in the experimental group, 90% of them were having normal cognitive function and 10% had mild cognitive impairment in age group 60 to 70 years. And if you look at the control group, it was the same. To maintain the homogeneity, it was same. 85% of the people had normal cognitive function and 15% had mild cognitive function. If you go to the next table, table 2, mean, which reveals the mean pre-test and post-test brain functions of aging adults in experimental control group. The table reveal that in the experimental group, in the pre-test, the mean brain function level was 26.20, and in the post-test, it was 28.50. It increased a little bit. In the control group, whereas there was no much change, in the pre-test, it was 26.10, and in the post-test, it was 26.15. And table 3, if you look at table 3, it reveals the effects of cerebral training exercise module on brain functions of aging adults and experimental control group. Um, it reveals that the obtained t-test value was 7.254, which was above the table value, and it was found statistically significant at 0.05 level of significance. And there was an independent t-test that was conducted between the post-test experimental group and the post-test control group, and that was found to be, the t-value was 4.638. That was again found to be significant statistically at 0.05 level of significance. You may be wondering which tool did I use to collect data. I used RUDA's scale, that is Rowland's Universal Dementia Assessment Scale, to assess the brain function level of elderly people. And I found as a result of these things that cerebrotraining exercise module is an effective method to improve brain function among aging adults. And I would like to say that our nature has its power, and our Indian system of knowledge, which existed from ancient times, has its own set of information. And when I did my review of literature, I found that very few studies from Indian point of view is published, and not a lot of research is done in this area. So I decided that I, being an Indian, should improve the Indian system more and make the other worldly people, other world to know what we have here in India. So I decided to do this research, and as a result, I found that this cerebral training exercise module is an effective way to improve the cognitive functions or brain functions such as memory, judgment, language, and other aspects. Thank you so much.
Thank you very much, sir, for the great work you have done. Actually, this topic is relevant to today's conference.
So this was a PhD program being conducted by this person presenting this Mr. Das, will be Dr. Das after completing his work. And the elderly population has chosen 60 to 70 years, and 20 individuals in each arm. Only 2 had impaired cognitive function in one group and 3 were having impaired function in second group. So probably this study will be finally objected to with reference to the impaired population very little. So you have to increase the sample size for your work, and many of the technical jargons which many of the students of nursing, NM, GNM, even BSc, MSc may not be knowing, because this is the future journey for all of you to pursue the PhD program for research. So this is just an acquaintance for you with the kind of work you are required to undertake in PhD program, ethical clearance, and data collection, statistical analysis, and what are those softwares, what are the hardwares, these things you have to acquaint yourself, that's all. So probably thank you very much for presenting your work, and the work is under progress, still not concluded, so we have to wait for his results. So probably there is no need of any question or comment from the crowd for this type of topic. Thank you, madam.
Thank you very much, sir. Thank you all scholars for your valuable presentation. Now, I remain most grateful for the rapt attention with which you sat through this lecture. I'm confident that you have learned something better from it. Thank you very much, all the delegates. Now, to begin with the expert session, I would like to invite our co-chairperson, Dr. Mini KV, Professor HOD, Department of Rachnasari, Guru Shri Gorakhnath Institute, Medical Science Ayurveda. She's dedicated and loyal in her work. Madam has 29 years of experience in her field. She did her master's in Bharati Vidyapeeth, University Pune, and pursued her PhD from Banaras Hindu University, Varanasi, UP. She started her clinical practice as traditional Marma Sikshak in Nangelil Ayurveda Vaidyasala, Kerala. After her PG, she was promoted as academic in charge of the same medical college. She gained experience as assistant and associate professor in Department of Rajnashar Ayurveda Mahavidyalaya, Uttar Pradesh. Madam has published 14 papers in national and international journals. Presently, she is continuing her excellent service in our esteemed institution. I'm really happy to invite our co-chairperson, Dr. Mini KV, ma'am, to deliver expert talk on today's session. Over to you, ma'am.
Thank you, ma'am. शान्दागारं भुजगशयनं पद्मनाभं सुरेशं विश्वाधारं गगनसदृशं मेघवर्णं शुभाङ्गं लक्ष्मीकान्तं कमलनयनं योगिभिर्ध्यानगम्यं वन्दे विष्णुं भवभयहरं सर्वलोकैकनाथं वन्दे विष्णुं भवभयहरं सर्वलोकैकनाथं. Good afternoon to one and all. Respected dignitaries, our Honorable Vice Chancellor of Mahayogi Gorakhnath University, Honorable Mahayogi Yogi Adityanath ji, our Pro Saturn Vice Chancellor, all our dignitaries, Vice Chancellor Sir, Abdul Bajpayee Sir, our respected Chairperson, Dr. B.L. Bhatta Sir, all the dignitaries, the faculties, Principal Ma'am, and all the students and faculties of this Guru Shri Gorakshnath College of Nursing. We are here to deliver in such a manner an international seminar related with a boon for future nursing. And this is related with an ancient Indian knowledge system. Now, we know that whenever we have a vision, then and then only we can make such a creation. There's a creation related with the nursing all over India, and we are here to be abroad. Not only the nurses are creating, we are making them talented in this university to make them a well settled and a boon to the future. This is where the Indian system of knowledge, or I consider the Guru Gorakhnath Institute of Medical Sciences, Ayurveda College. We are here to present with a vision that is, anyway, you can look anywhere, but you want to think only the thing what you want to see when you are a nurse. This is ancient Indian system. As an Ayurvedic nurse, we all know that it's a typical photograph. We know that this Susrutacharya, Acharya will make the father of surgery as the ancient being. You all think that this is the nurses and the helpers, what we need from ancient life, from 5,000 years back. We want to think that not only today we, the nursing people, are here with all the setup. This is a new era. We want to be well versed with all these ancient knowledge systems. It's a traditional way. Ayurveda is considered to be the oldest system of healthcare. This literature, we can see this is from back 5,000 years. And this is mainly an oral tradition. From face to face, or there is no written document. But when you come to the Veda, Ayurvedic era, we can say the healing system has been practiced in daily life, in homes. And more than 5,000 years, we are back to it. Ayu, that means the life. And we know there is the knowledge related with Ayu, which is given in Ayurveda. So this is science of life, that is the knowledge of life. Now, what was there in our Ayurvedic documents? We can say we call them as Chadushpada, the 4 factors which are responsible for a well treatment procedure. So here we can see Bishak Dravyanyubhastada. These are the main 4 factors which are explained there. These Gunavat Karanam Nyayam Vikarat Anyat Ubaded. All these 4 factors are essential. And they are very much characters with 4 factors again to these ones. One is the bishop. The first one is the doctor or Vaidya, what we call Vaidya. Then the medicine, the Dravya. Another one, that is the Ubastadas, the Parijaragas, the helpers, the nurses. That is the thing. Another one, that's the rogue. All these 4 factors are essential to fulfill our treatment. And then only we can complete our treatment with a good result. That was explained in our Granthas, in the Ashtanga Hridaya, Charaka Sutra, and in Susrut. These 3 Granthas. When the qualities of vision, we all know that all the doctors should have a good, and they want to be an expert. In their field, they want to be expert. In each and every field, we all want to know that there we are studying as a theme or theory or practical, whatever it may be. You want to be well versed, the theory and the practical. It is in all the fields. In bishop or Vaidyas or doctors, they want to be an expert in there. Another one, there is an academic qualification. We think that in the previous years was Gurukula Vidyabhyas, what we can see. But nowadays we can see this was a training, and the trainer should be such a situation. The approach, what we think here is the infrastructure, all this in the new era, we know that. But when there was from the homely atmosphere itself, we know that we have the way of treating the people in our homes, the neighbors, and all these things are work. This was academically qualified. Another one, they want to be experienced, the theoretical as well as the practical experience. It was well, and the hygiene. Hygiene was well versed in the Ayurvedic terminologies. We need this. When there are royal physicians are there, they want to look after the Maharaj. So all the Raja, they want to have such a creations. They were well versed. One who possesses the whole knowledge regarding the cause, the diagnosis, the cure, and the prevention of diseases. They were considered as the royal. Now there was the relation between the doctor and the patient. It was also very, very important. Here the doctor should be sympathetic and kind to all patients. concerned with those who are likely to be cured and feel detached with those who are towards death. So this type of a relationship between the doctor and the patient, doctor and the nurse, doctor and the medicines, they know all the medicines, all these are expressed in the ancient Indian literature. This is what is we want to think of. Another, these are the qualities of Dravya, the medicines. Whatever you are using now in the modern era, the shape, the size, whatever it might be changed. But the same thing with extract and essence used as nowadays as a medicine in the modern era. Now we want to think all these, they want to be in abundance, they want to be in suitability in the multiple form, and the potency should know to each and everyone. Now we see the Bahukalpam or Bahugunam, the polypharmous quality of drug. This was explained in early 5,000 years back. Not only now, but we change from that era to this era, the modernization. This will bring us a very good way to live, to express our views, to give the medicines in such a manner. It is easily assimilable, broad spectrum, and readily available. And this could be applicable to the patient also. Now the Ubastada, we call them as the Ubastada or the nursing, and nothing other than this. This is the way they want to have a good knowledge of nursing. इसलिए we want to give some theoretical way or the practical way. We want to give them training. The most important thing is the training. How to behave with the patient. How they give love and care to their patient. With the ill person, how we can behave to them. All these exercises. Dexterity. They want to look very good. Want to be well versed in there. The tone, the words, what they use, all should be very good. That was expressed. Affection, love and affection. What we call them as the love and affection of these nurses, the upastadas. That should be very peculiarly explained in our granthas. And the purity. So I think I always thought that whenever there is a dress code to these nurses in the previous years, I thought that only white and white. The white color should give a very purity towards the looking person should have some purity inside and outside. So we want to wear the white. This is the way how Ayurveda explains everyone. Now we want to have an excellent communication skill. It's a skill how you talk to others. There is a patient, they have very much pain. Then how we want to talk to them? Now this is one breaking point what we want to think of. How we can talk to the others. How we respect the patient even. Emotional stability. We don't want to be very emotional when we see a critical case or an accident site. No, you don't want to be very emotional. You want to make your willpower should be very much in each and every person. And you want to have an empathy towards this. Another one, there is an attention to the detail. All these things should be, there was in art. Next one is the rogi. We want to know that the rogi is also very important. When you know the patient does not have this good memory, और वक्त change करने वाला है तो हम दिक्कत. Next one, there is obedience. Patient should be obedient to the doctors, to the nurses and all. This is the way. Another one, the fearlessness. Don't give fear to the patients. They want to be very much, they want to be fearless in their way and they want to be very calm and quiet. And you want to they want to look after all these, the rogis. So the uninhibited expression. Or if, even though we know that within time, within hours, there is something to happen to that patient. Even then, we want to be very stable. Nothing will happen. You gave them very much motivation. Within 1 or 2 hours, maybe. This is not in our hands. Even then, this was explained also in Ayurveda. Another one, Adhyo. This was also explained there. Because they want to be economically be very good. The patient should be very rich. Nowadays, it is a very important thing. You know that how the hospitals, the infrastructures, and the sophisticated instruments, whatever it may be. When you have no money, there is no chance of getting good treatment. That is also there. So we can say patients should be very rich enough to afford the treatment. They want to be obedient and their communicative skills should be very good and they must be courageous. So there is an importance of physician after all. We know that after this nursing and all these things are also essential as much as the doctor. But though quadruped of therapeutics in all, equipped with the 16 qualities, Shodasha Gunas, these are responsible for the success of treatment, yet the physician, by virtue of its knowledge, administrative position, and by prescribing capacity, occupies the most important position among them, even though we are, हम किसी से कम नहीं, सहमत है? Nurses, सब लोग एक जैसा काम करना पड़ेगा. That is what is written in any word, from the ancient to the new. All are same. We want to think, we want to do. But these are some Ayurvedic procedures, what we can. Next slide. These are the procedures. Now we enter into this. That is, we need some. After the BSc nursing, now the government of India, get to start the post-basic in Ayurveda, nursing in Ayurveda, because the knowledge related with the medical field, the medical education, they want to try much more also. That is what I want to present from the ancient literature to the modern era. We have these types of Panchakarma therapies. We need the therapists, we need the masseurs, we need all over. But when they are also with the nursing degrees and all, with the knowledge and the skill, that is what we need today. So all these are the procedures what we can basically in Kerala. We know that the traditional massive procedures and the Panchakarma, यहाँ हम लोगों का Panchakarma center, it was well versed, and there are so many treatment procedures we started. And here also we need the nurses. The nurses or the therapists, whatever it may be. But the change they have with their degrees, with their knowledge, with their skills, they can treat all this. You have another opportunity, I think. You get more opportunity. Job opportunities are goes on increasing. Not only in the private hospital, in the government hospital, in anywhere. You want to enter into the next field. That is what I want to show you. Another thing, these are some of the Satadhara. And these are instruments. You all know, you want to know. These instruments on the left-hand side. Next slide. These are the instruments at the time of Susruta Acharya. These are with the different shapes of the mukhas of animal. Whatever the shape, the names are like this. The modern treatments, you know that. All the nurses, they want to help others. So from the time, immense of thus, we have all these varieties of things. They know that they do these all things, the surgeries and all from the relevant time. Now we reach up to this, the stainless and whatever. All these instruments are using. Yeah, another time also. Now we have this. The nurses in today, the 4 factors, what was explained in Ayurveda, are now like this. The shape, the dress code, even to the patient, even to the setup in the hospital has changed. And all these, the same thing, what was explained in Ayurveda, nothing else. The 4 factors, the doctor, the medicine, the paricharaka, and the rogi. But we give them a new, you call, as हम लोग बोलते हैं ताकि पुराना वाइन ने नया बोटी, ऐसा हम लोग भी करते हैं. कुछ चीजों को हमको नया नया लुक आना चाहिए. We need such type of the modifications, the modernizations, whatever it may be, we have, and all of you are supposed to come to this way. Now this is the scope of nurses to get more job opportunities in Ayurvedic hospitals like Panchakarma centers and all. There is a case known as the post-basic diploma in Ayurveda specialty nursing residency. This post-basic after BSc nursing, you can enter into such treatment, Ayurveda specialty nursing 1, and there is Ayurveda specialty nursing 2. You have also the post-basic. If you are, there is a scope. We are the Panchakarma. We Ayurvedic people want to get abroad, and we also want to make this into globalized. So we are in this path to get a trained nurse to do all these things. After nursing, there is a scope of getting relief to all. So these are the courses where you want to study some Sanskrit, then the basic in Ayurveda. These are the basics. Then come to the same, that is the modern as such you want to do here also. And this Ayurveda nursing and pharmacy, this is intended to educate and prepare professional Ayurveda nursing and pharmacy workers to ensure accurate care to patients, especially when situation is related to pandemic outbreak. You all know that at the time of pandemic, Corona, and this COVID-19 make us aware of so many things. We want to be alert in all the situations. It is here, it was there, it is here. ये हमको कैसे भी handle करना ही करना. So all of the nurses should be here with us to make all these structures help. Now we need the personal mastery. The key, what I want to say is the leadership quality and the skills in each and every nurses. They want to be a very good leader. So the personal mastery is a critical component for leadership component. Outstanding leaders with a self-confidence, they are able to trust and empower the others. So they must communicate and they take action accordingly. Not only your job opportunities in this, we can be with modernization along with us. We are also looking for. This is the care environment, what we want. One, nowadays it is patient based, or the patient is in front, first choice to the patient. So patient based care, we want to be a professionalism. We know how to behave. Next one, system based care. Each and every system you want to think, and there is specialization for each and everyone. Then quality improvement. We want to increase all our qualities. And this is the informatics and technologies, AI, what's going on here, robotics, all these things you want to know. Then there is collaboration and teamwork that should be there. And there is communication. It should be very much evidence-based care, and the leadership will bring you into the next step. Now we all know that there are midwives, the nurse midwives. That is the way we are thinking after delivery in Ayurveda also. We, from the time immemorial, we know that they come to the home and they take the deliveries, and there are so many, and these are all the paricharagas, and we need now trained nurses for this also. We want to have such training to each and everyone, the registered nurse with additional training as a midwife who is certified to deliver infants and provide prenatal and postpartum care, newborn care, and some routine care. These are some gynecologic examinations. This is a specialized wing, and you can take this as the specialized. They provide the full antenatal care, including parenting classes, clinical examinations, and screening. When and only you have the degrees and you know the knowledge of all this, then you can come to. This is the conclusion. The four factors, they are harmonious, the treatment will be successful. Success of Chikitsa, that depends upon the four factors, and these four padas possesses the specific qualities. Again, four specific. Among the four, Vaidya is the most, and the other three is also, we want to navigate them. The educational goals during this time, the speakers, they explain facilitating basic knowledge acquisition, improving the decision making, enhancement of the perceptual variation, improving skill coordination. We want to practice rare or critical events, learning team training, and improving psychomotor skills. This is different technology. We can say this is the Tantra, what is basically in Ayurveda. These tantric ways, this technology, the tantric, this is the thing what is given in our books also. The task of medical educators is to use these new technologies effectively to transform learning into a more collaborative, personalized, and empowering experiences. This is from Phyllis A. Guys. This is education rapidly changing. We know that this influenced many factors, including the challenging healthcare environment, changing role of physicians, altered social expectations, rapidly changing medical science, and the diversity of pedagogical techniques. Here, now, the changes in societal expectations put patient safety in the forefront. This is, I'm very thankful to the organizers and Mahayogi University to give me a chance to deliver my speech and my view. Professor, I'm very thankful to all of you for the patient hearing. Thank you very much.
Thank you, ma'am. Mini ma'am has made a major impact on the forefront of this nursing care with reference to the Ayurvedic knowledge. Any questions, comments, anyone? कुछ लोग पूछा कीजिए भाई, आप लोग पूछते नहीं है। चलिए मैडम यहीं पे अवेलेबल हैं इसी यूनिवर्सिटी में, तो आप लोग मैडम से मिलते रहिएगा। शी इज अ रोल मॉडल टीचर, रिसर्चर, एजुकेटर, so kindly be in touch with her. Thank you.
Thank you, ma'am, for your wonderful presentation. Next, I would like to invite our chairperson of today's session. Sir merely needs any introduction. However, it's my great pride and privilege to stand here to introduce him. He is known for his distinguished hard work in the field of radiology, his wonderful administration, and high achievements of the institution. Sir has completed. It's okay, sir. Anyway, it's my duty. So, with a lot of achievements, he had been worked many places because of time constraint. I will give you. Sorry.
Thank you, ma'am. It was time constant for her. For me, it's very humbling to face my own description, appreciation. So that makes me very uncomfortable. In fact, I'm really honored by the kind words, but it's very humbling also at the same time. So, in conclusion, in this session, I have to give my concluding remarks and then some small presentation also. So my concluding remarks first, which was to be done later, and about my talk, most of the things have already been covered with reference to Indian knowledge system and everything. So I'll be just passing. Another thing that 1 o'clock we had the schedule of lunch and we have already passed one. So between you and lunch, I'm standing. So I'll try to finish as soon as possible. I would be spending 20 minutes of allotted time. I'll try to finish in 5 to 7 minutes. So thank you for your patience since morning. You are so attentively attending this event international conference. I congratulate you. In this session, Mr. Subham from All India Institute Gorakhpur and Ms. Sakshi Sharma from AIMS Gorakhpur, they presented about AI, robotics, their role in healthcare, nursing care, education, research, training, and everywhere. And then Mr. G.L. Das from Puducherry gave about cerebro training exercise modules among the aging population. He explained the basic tenets and then about his research in the area, which has got the encouraging outcome. And I congratulate him for his wonderful research work. Mr. G.L. Das, after you complete, you'll become Dr. G.L. Das, and I congratulate you in advance for getting PhD in times to come with your wonderful work. Professor Ved Mini KV from this Ayurvedic Medical College of this great institution gave a wonderful talk and glimpse about what is from our ancient times and what is how it's relevant for today's time. My task is simply to acquaint you, give to a bird's eye view about the nursing profession, starting from ancient times to modern times where we are. So all of you have to just not give much attention, just to keep on seeing the slides or listening to me, and you'll get acquainted about where we stand with reference to starting from ancient posterity to today. So my presentation, I think, has come here. I bring my greetings from King George Medical University, one of the oldest, started in 1905, 119 years back, oldest institution and the biggest medical institution of the country, the largest medical institution, medical university, medical college of India. To this great seat of learning, which is capitalizing on the spiritual, religious, the strength of this great seat of dharma, that is Gorakhnath Peeth, and you are all fortunate to be the students of this great seat of learning with wonderful infrastructure and the kind of training program under the leadership of Honorable Vice Chancellor Dr. Atul Bajpayee sir, and under the blessings of Honorable Chief Minister and Chancellor of the University, Guru Yogi Adityanath Ji Maharaj, you are very lucky to be participating in the academics of this institution, and this conference is also one of the way to make you acquaint with the work, whatever is happening outside this institution. Without much time, I'll be coming on to the nursing definition, which I need not read. You have just to see this is related to the prevention of diseases, promotion of health, care of the sick, disabled, and those injured, and rehabilitation. So every aspect of health care is being covered by the nursing. This is the roadmap for the physician also, and same holds true for the nursing. This is the modern day requirement of a nursing professional. So you have not to restrict yourself just to prescribing the drug or implementing the treatment orders. You have to participate in every aspect, and that will make your stature is bigger and your achievement larger. Next, please. Definition of nurse has already been discussed: prevention, promotion, and nurse is one of the oldest profession. Nursing started from the antiquity. Care of the sick, disabled, care of the sick, disabled, and those suffering are not able to take care of themselves, very elderly, very newborn. The nursing is the keystone, cornerstone for their survival even. A newborn, human newborn, cannot take her requirements, needs. So only the mother and others associated, if even if there is no mother, someone has to take care. So this is the oldest profession on the earth. Since the human civilization, human life, the nursing profession continues. So we have to take our responsibility in that manner. Dhai or Dai, which was ancient time. I like to elaborate little bit here that the Indian culture in our country, we were self-sufficient in majority of the issues of our society. It was educational, spiritual, religious, financial, agricultural, industrial, every aspect of the need were taken. Villages were self-sufficient units. Every village used to have one or two Ved, who were the physicians with the traditional knowledge, the home remedies, the herbal knowledge. They were having the access and knowledge about the uh, nani maa ke nuskhe, dadi maa ke nuskhe, and all these things. Even they are present in our families today. So they were looking after the emergencies, first aid, and all the poisoning and everything, and that knowledge was passed on from the generation to generation. And similarly, there used to be a nurse known as Hai Dai, or maybe any other respected name, and she used to conduct all the delivery in the safe motherhood and guide the newly emerged mother how to look after the child. She used to train the mother also, looking after the child also. So this is a kind of profession which was continuing. What as a modern nursing professional we are sitting here is a very formalized system of the, and this is the best way because we capitalize on the past, but we should not forget the past and antiquity. If we forget that, then probably the human touch, what is known as compassion, karuna, daya, prem will disappear and it will become a dry profession which not be rewarding to the self, to the patient, to the society. So we have to take care about this oldest profession. During Vedic period, the things have been taught. Dhanvantari is the god of health. Charak Samhita and Sushru Samhita about the medicine and surgery treatises has been written in our country, and they have been the lighthouse, immense source of knowledge, not only about the disease illness. Illness is one part of the healthcare system. Total holistic health was taken care, and they have taken to the extent you can see that the four limbs of health care system which madam has so detailed elaborated, so I will not be going. And out of the four limbs you can see the upcharika, nurse, attendant, who's looking after the ill, sick, and suffering person. So that is kind of description replete in our literature. Next, please. And four characteristics of nurse has been elaborated, has again been so well elaborated by Madam Mini, so I won't be going in detail. Charak Samhita was written in 600 BC, and it gives this instruction to the physician how to take care of the patient suffering. And it talks about the nurse who should be resourceful, devoted, with purity of body and mind. What the Veda has taught Chatuspada in Ayurveda, and again Charak Samhita writes, taking care of the patient, preparing drugs, and ever willing to help, which is the most important. Ever willing to help. That is what we have to imbibe. Next, please. Role of nurse was performed by women in the families and communities. During the colonial period, British period, the modern day nursing originated from the battlefield, looking after the sick. Even before this modern British Empire or colonial rule, the wars were being fought, and ladies from the empires used to look after the sick who were brought back from the battlefield to the posterior backyards. So they were being looked after. So this nursing, even the battlefield, women used to, male nurses and women of the families used to go who had the expertise to look after the sick and injured. So that is the kind of presence in our society. Unfortunately, we forgot all our cultural heritage, our achievements, historical perspective, and we are always looking after to the west for all kinds of modern things to happen, thinking it that the modern things are the best thing, and that is not true. So with that background, the modern day first school of nursing was started in Madras in 1867. Next, please. And first trained Indian nurse was by Kasibai Ganpat, who was trained in 1891. Next, please. Florence Nightingale, who participated in Crimean War, looking after the injured and sick, day in and day out, and nights also, with a lamp in her hand, locating the injured, those who are unconscious, injured in the war, they cannot even make their presence felt. So with the lamp, and that's why she is known as the lady with the lamp, an ideal modern day person belonging to the nursing profession and whom we worship and revere with. In 1859, Valérie de Gasperin and her husband Aguilar de Gasperin opened the first nursing home in Switzerland. Next, please. Nurses education, we know that all kinds of nurses education, ANM, GNM, post basic, BSc nursing, MSc, PhD, every program is being run in this institution. Next, please. So in our country, for meeting out the Millennium Health Goals and for the sustainable development goals of the country and the world at large, defined by WHO, World Health Organization, and World Bank, we need to have the healthcare professional. We know that the society depends on the progress of the society depends on two pillars. One is health and another is education. So health is so very much important, and you are in the educational process. So you are in the process of education, and you are healthcare educational professional. So your role is very important for all kinds of societal goals of the country and the world. Next, please. In India, we have shown that has also been discussed also earlier that we require 3 nurses per thousand population. In our country, we have only 2 nurses per thousand population. Currently, we have around 35 lakhs nurses, around 36 lakhs. So 18 lakhs nurses are required urgently for the current need, not think about the future population growth. And when we talk about the 36 lakh nurses registered in our country, many of them, a good percentage of them must have left the active profession, retired, and many may not be on this earth also in our country. But that is the total number. So actual shortage is even much more than the 18 lakhs which I am giving the statistics from the government of India. And ANM, GNMs, they constitute the majority of not only nursing professionals, majority of the healthcare workforce. Healthcare workforce, more than 50% workforce belongs to the nursing professionals. So you are very strong pillar and you are finding a rightful place currently. The respect, salary, recognition, everything is coming. you have to rise to that occasion. And I'm proud to see that you are all, showing the sign of that journey, that confidence to rising to the occasion. So this I have given, but the nursing education currently, the last 2 points, 42% of the nursing education institutions are concentrated in southern states of Kerala, Tamil Nadu, Telangana, Andhra Pradesh and Karnataka. Almost 50% in 5 southern states, and northeast, which has got 6, 7 states and union territories, they have only 2% nursing education. So what we say that the English education, Christian missionaries, they have the potential to spread the nursing education. That is also not true. Northeast, predominantly Christian population. It's not nothing the journey of the language or religion. It's the journey of the society. And society has to come forward. And fortunately, this kind of institution coming will be a role model for future for all of us. Nursing education, as I talked, the Portuguese, they started. Next slide, please. East India Company established the nursing college in Madras, and first nursing college, it was a midwifery course started in northern India at uh, Agra, which was the Thompson Hospital at Agra. It was midwifery course started at that college, medical college. Now that Agra Medical College started from that nursing midwifery course to the modern day medical college, which is known as Agra Medical College. Next, please. One thing you will appreciate, at the time of independence, we had only 7,000 nurses for entire country. The population was around 40 to 45 crores. And for such a huge population, we had only 7,000 nurses. And currently we have 35 lakhs. So I told you that you are tired since morning, but don't stop listening to me. So I'm giving a very broad idea, so not giving a very technical detail which will confuse you. So 35 lakhs currently, and we say the country is in the acute shortage of nursing professionals, nursing workforce. And at the time of independence, you'd see only 7,000. Is that the British, they bought the modern education India. They did a lot of further development of the country. Only 7,000 nurses concentrated in metropolitan cities, looking after the British population and military. That was the whole story. Next, please. So modern day nursing started from 1946 when the Indian Nursing Council was established. Subsequently, next is the State Medical Nursing Council with the for uniformity of nursing education, Nursing Council primarily then maintains the register, discipline, new curriculum, then all those things are being done by the Indian Nursing Council. Next, please. Nursing council functions, I'm not going to talk. All these things are recognition and those things. The state nursing councils, we have many state nursing councils also present in our country. And Uttar Pradesh was one of the first where it was started in 1934, even before independence, the state medical council. Because autonomous states were present before the uh, independence. Next, please. So Indian Nursing Council and 29 state councils, they are involved with the uniformity of nursing education, and there are so many numbers of the institutions. I'm not going to talk, we should not look at that number now. Next, please. All these courses running in this institution, nothing to see into that. Next, please. What is the National Education Policy 2020? All those digital, AI, and all those robotics, all this telemedicine, and everything has to be incorporated with the collaboration, international, national collaboration. So what is the most important thing which you should go back? The nursing professional should look for the opportunity to collaborate with the Ayurveda, with the modern allopathy, with the other systems of medicine, conventional knowledge also, the household remedies, all those herbal remedies, everything, because this is knowledge which is going to empower you for the better care of your patients. Next, please. And what should be done for increasing the nursing colleges have also been talked by one of the preceding persons. Increased investment. Then what has been achievement since 2014 after Modi government came? This is very startling. You should see, and probably this is the last slide. So 157 new nursing colleges will be established in 2000. Am I audible there? Audible? Okay, thank you. So 2023-24, 157 new nursing colleges are to be established in the existing medical colleges where there are no nursing colleges. And states are advised by the central government to improve this regional imbalance like Northeast. And one thing I'll share here, and that's the end of my talk today. In King George Medical College, now King George Medical University, Lucknow, the medical college was started in 1911. Hospital was established in 1905. And almost after 105 years establishment of the college, the BSc nursing course was started in King George Medical College in 2016-17. MSc was started in 2017-18, just 5-6 years back. PhD program started in 2019 and 20. It was only running on the initially all those healthcare helpers course, then ANM course, then GNM course, and all those things. So you are in an institution, you cannot comprehend how much it takes for a journey of the educational system to evolve. Oldest and the biggest institution coming with BSc nursing 5-6 years back after more than 100 years, and from the very beginning you have that kind of, so you have all to integrate yourself with the clinical care. BSc students interacting with ANM interacting with GNM is interacting with PhD, so that each one of you inspire each one of you. That is what is the way forward for all of us to grow together. And if you'll help someone grow better, I'm telling you, he or she may not grow, but you will certainly grow. Your approach to help others will cause your growth. So that is what is important. Last thing, when I come to deliver a talk, sometimes we as the professionals, and I'm a teacher, I'm a professor, primarily a teacher. So as a teacher and as a person giving lecture or talk, we are motivated by the idea to give a masterly talk to the audience, to impress the audience. That approach is not correct. The correct approach is what the knowledge I'm going to impart to the audience. It should be audible, comprehensible, understandable. Communication should be clear. So that whole idea of causing benefit to the audience, and that has to be the approach each and every sphere of your life. Whatever you do, nothing to do impress to anyone. Try to impress yourself, and that is the end of your story, and that will cause your happiness, progress, growth, and rise. So, with these words, I close down myself, thanking once again Honorable Vice Chancellor, the University Administration, the Principal of the Nursing College for inviting me, giving this opportunity to me to talk to you, giving few ideas and my thoughts to you. And that is what is my job, to try to be helpful, giving some direction, throwing some lights on the future path for the rising and budding medical professionals who are going to be the pillar of strength for the nation to grow, for the health sector to grow, which is very important sector for the growth of the country as a whole. So you have to go back with the idea that you are working for a very noble and very great cause. Thank you very much. Wish you best of luck once again. Thank you very much.
I would like to give a ton of thanks to you, sir, as you made the session clear and informative. Your thoughts have enlightened our mind, I think you have shown us a new path. This will surely be going to encourage us in future events also. Now it's the time to honor our guest. For the same, I would like to invite our Vice Chancellor, sir, to honor the chief guest with a memento. I request our Vice Chancellor, sir, to honor co-chairperson, Dr. Mini Madam. Thank you very much, sir. Thank you. Here comes the end of the first session. I extend my hearty thanks to all of you for finding some time to take part in this session. Once again, we are grateful for the experts for the valuable time and effort you took to share your thoughts and experiences with us. So we put all effort with a great support with the team. Thank you very much to everyone patiently listening to the experts.